Have any of you ever had a severe injury? If you had, more than likely you did physical therapy with a physical therapist. This is the career I want to pursue. Webster's Dictionary states that physical therapy is treatment or management of physical disability, malfunction, or pain by exercise, massage, hydrotherapy, without the use of medicine, surgery, or radiation. I want to become a physical therapist because I want to help people, and it's a job that always been in demand. I did a lot of research on physical therapy before I decided my major, so I know a lot about it. Today I'm going to talk to you about the history of physical therapy, some of the perks of the job, and the day-to-day life of physical therapists. First, I'm going to give you a brief history of physical therapy. The field of modern physical therapy was established in Britain in the late 19th century. Shortly after the establishment of modern physical therapy, American orthopedic surgeons began training young female physical education majors to care for their patients. The first physical therapy school in America was the Walter Reed Army Hospital. It was built shortly after World War I. 14 additional schools were soon followed. In her article, The History of Physical Therapy, Rita Hunter writes that over 800 therapists called Reconstruction aides were trained and utilized in the military around this time. After World War II, physical therapy became more commonly used to care for patients for a number of reasons. There were a lot of injuries in World War II and the Korean and Vietnam Wars, and the number of elderly people was increasing, and increasing chronic disability and pain. Both of these require a lot of physical therapy. Now that you know the history of physical therapy, I'm going to tell you some of the perks of being a physical therapist. There are a lot of perks that come with the job, but one of the most important ones is there will and always be a demand for it. This is because becoming a physical therapist is demanding and requires a lot of time, and keeps a lot of people from doing it. Another reason is older people have always used physical therapy, but now younger and younger people are using it because there are so many different kinds. Dr. Laura Inverardi, who has a degree in physical therapy, claims that the 5 most common types are orthopedic, geriatric, neurological, cardiovascular and pulmonary rehabilitation, and pediatric physical therapy. Other perks of being a physical therapist are very similar to other jobs in the medical field. There's a large variety of places you can work at, but the best perk of being a physical therapy is you get to help people and improve the quality of life. Now that you know the history of physical therapy and some of the perks, I'm going to give you an idea of what a physical therapist does every day. Just like most medical jobs, every day is different. Physical therapist Debbie Compton said, I have a set schedule of where I'm supposed to be, and I have a few meetings that are certain times every week, but my day is always different. Every patient is different, so treatment for every person is different, even if they have the same injury. Debbie explains by saying, we try to think about what the patient really needs and do, and cater the therapy towards that. A common day for Debbie could include helping a child with motor development, then teaching an adult to walk on crutches after an accident, and finally helping an elderly person get back to walking after surgery. Debbie said she usually spends about an hour with each patient. Today I've shared with you my goals of becoming a physical therapist. I told you the history of physical therapy and some of the perks that come with the job. Then we looked at some of the everyday tasks a physical therapist has to perform. Every day there are new developments in physical therapy and new treatments are discovered. I hope that none of you are ever in physical therapy, but if you do, I hope this information helps you know more about the people helping you. Thank you.